Hello, this is Joe Trahan, welcoming you to the All Me podcast from the Taylor Hooten Foundation, whose mission is to enlighten the world to the truths about appearance and performance-enhancing substances. As the national leader on this subject, they communicate their educational messages through various methods, including this podcast. Thank you for listening and enjoy the show.
Hi, and welcome to the All Me podcast. My name is Tavis Piatoli, sports dietitian for the Taylor Hooten Foundation, and today I'm going to be your host. Currently in the United States, there are 131 million individuals who use prescription medication, whether that's to lower high cholesterol or blood pressure, or to treat a specific disease like diabetes. The pharmaceutical industry generates close to $500 billion in annual revenue. With the amount of individuals using prescription drugs today, how many realize the medication in which they are taking could be depleting their body from important vitamins and minerals? In this podcast, we speak with pharmacist Dr. Jessica Beal, who discusses the role of medication on vitamin and mineral depletion. We specifically dive into which medications pose the most significant risk at causing the nutrient deficiency, along with what type of side effects to expect when deficient. We close out with how to prevent nutrient depletion, but stay tuned until the end, where Dr. Beal explains what she would say to young Jessica if she could go back in time. Dr. Beal is an athlete and healthcare provider and was a 3-sport letterman in high school as a club volleyball player, 4 years as a Division I player in volleyball, a CrossFit athlete, and currently a national and international Olympic weightlifter. She understands the grueling workout schedules, balancing school with competition and training, and trying to find rest and recovery in both mind and body. As a pharmacist for over 15 years, most of her career has been dispensing medications for chronic conditions and educating thousands of patients about their health, disease states, medication, and supplements. However, as the community pharmacist's role has evolved from just dispensing, she dove into integrative and functional medicine foundations to be a better health professional and coach for her patients. She realized the core of most patients' conditions, as they often miss the foundations and tools for understanding nutrition, daily movement, quality sleep, self-care, and the impacts of chronic stress. Dr. Beal, thank you so much today for joining us on the All Me podcast. It's an honor to have you.
Thank you for having me. I appreciate it.
So this is going to be a really cool topic. And before we get started, I just want listeners to know this is not Jessica Beal, the actress. This is Jessica Beal, the pharmacist. So it's a little bit different. When I first saw the name, I was like, I wonder if she's going to look like the actress. And then she came on and we were talking months ago about different things. And I'm like, I thought you were the actress. And she's like, no, I'm the pharmacist. So I just wanted people to understand. Same name, just a little bit different profession.
Yeah.
All right. So this is a really cool topic, talking about the impact of just medication on nutrient depletion. But before we really dive into that, let's talk, or at least let our listeners know a little bit about your career path as a pharmacist and what interested you in becoming a pharmacist, but also tell our listeners about your world as sports pharmacy and what this involves, because this is pretty new.
Yeah. So I grew up, like, sports has been my entire life. I played from when I was a kid. My parents were both involved in sports, my brothers, me. I played sports my entire life, and it's just been part of kind of who I am. And I always thought I wanted to go into like a healthcare profession and helping people, love helping others. And I really thought like PT in the beginning. And as I got into college, I played Division I volleyball, and part of obviously college experience is figuring out what you want to do. I was incredibly lucky to be in a town in North Carolina, very progressive. And I got a job after I finished playing Division I volleyball as a pharmacy tech. And this pharmacy was only doing compounding, so making medications from bulk powders. But we also had a full-time herbalist and a full-time naturopath on site. So I got to witness and be immersed in the world of supplements and herbs and just more natural functional medicine. So that really, really intrigued me. When I was in undergrad, I did organic synthesis research, and I could have cared less about how things worked in the lab. And I really wanted to know why we were making certain molecules, how they worked on receptors. And one of my professors really sat down and said, Jessica, I really think you need to go into pharmacy, and started diving into that, worked in this pharmacy, and between the two of them, just really found my jam of integrating how does the body work, how do medicines work, how do supplements, vitamins, how does everything play together in the biochemistry of our bodies. So fast forward, I went to pharmacy school, loved it, but knew I wanted to come out and do something slightly non-traditional, not your regular retail pharmacy, not a hospital pharmacist. So I got into a local community pharmacy back home and really, again, thrived in developing wellness programs, a lot of unique programs that were kind of cutting edge, continued to grow our compounding department, and just found the similarities of patients with chronic conditions. I was talking to a lot of them about skills that they needed in order to improve their health that were very much similar to skills you needed as athletes. So I was talking to them about nutrition, about sleep, about recovery, about mindset, about breathing. And at the same time, paralleling, I continued in sports and did CrossFit for a little while and realized that I really enjoyed Olympic weightlifting. I started competing locally in competitive Olympic weightlifting, developed my technique, got connected with some amazing coaches. Currently, one is with Team USA, who's my head coach. And we really found out that I excelled in this sport. So I started competing nationally, internationally. Last week, I competed in the World Championships and got third. So I was really excited and found that there was a lot of ties and just intertwining of my passion for helping clients and patients in the pharmacy with their chronic diseases, and also helping athletes. A lot of athletes need the same skills. Nutrition, focusing on recovery, how can we optimize that? Just the two worlds seemed over the last maybe 4 years to combine and overlap. So I started working with a lot of athletes on optimizing nutrition, looking at nutrigenomics and genetics and sleep patterns, supplements for banned substances, for optimizing performance, for optimizing recovery. And just kind of that is how I got into sports pharmacy. It was the combining of my two worlds.
Excellent. No, it's fantastic because there's not a lot of pharmacists that really focus, at least I think, on the sports side. When I met you and Brandon, it was really interesting just to kind of learn, wow, there's a whole world that's focusing on that, because there needs to be more pharmacists that are really focused on the supplementation side. So I think it's fascinating that, we're finding more people passionate about helping athletes understand what they're putting in their body, making sure what they are putting in their body is clean and safe, and we can protect them from some of the misinformation that's being provided all across the country.
So much, like social media and like just the amount of supplements people are promoting that you look at and you're like, there's no safety behind them. There's risk of contamination. There's so much education along safety of supplements and what are you putting in your body. And for some, obviously, that is a risk of testing positive for a banned substance and not even knowing it. It's a lot of education, interestingly, on the pharmacist side. So you can walk, obviously, most people have been into a pharmacy. You can walk into a pharmacy and ask a pharmacist for a consult, and I'm going to go with 9 out of 10, or probably have no idea about what substances may or may not be banned for different athletes and different organizations. Like NCAA obviously is different than USADA and WADA. That's different than the NFL. That's different than like UFC fighters. And so I always find it interesting. Like when you talk to other pharmacists, you're like, one of the common ones that comes up that I usually use for example is like DHEA, like it's banned. And people are like, I recommend it all the time, for a lot of people for like muscles and for fatigue. And I'm like, no, like, it's just surprising. And like, the other one is like IV hydration. People don't think about like, athletes that get drug tested can't get over 100 mLs of fluids in a day without a therapeutic use exemption. And so there's all these IV bars out there that are popping up, and people are like, yeah, I'm going to an IV bar for recovery for this. And I'm like, wait a second, like you can't do that. And it's things that's promoted in the media, and this is what I use, and this is how I felt better. And you're looking at it going, oh yeah, no, honey, you can't use some of that.
Yeah.
Pre-workouts, same way, like there's stuff in
Right.
there, and I just shake my head at it.
It seems like we need to have we've done, we have a partnership with NSF, with the Taylor Hooten Foundation. And obviously they've been considered the gold standard when it comes to third party certification, but it seems like we need to have another discussion around supplements at some point, because you would think, pharmacists are the trusted source, or at least a very trusted source, because you see things like, and I know they're buzzwords in marketing, but pharmaceutical grade supplements. And we know 99.9% of supplements are not made in a pharmacy, they're made in a manufacturing facility, but it's good marketing terms. All right, let's dive into the topic today when we talk about drug and nutrient depletion. So first of all, what is drug-induced nutrient depletion? And can you define this term for our audience? Like, keep it extremely simple.
Yeah. So basically, we're just talking about like vitamins and minerals that your body uses. So magnesium, calcium, vitamin D, vitamin B, stuff like that. And the body, when you take a medication, it basically depletes it. So it basically, you have less of it. So your body, when you take a medication, it can affect the absorption, the metabolism, the utilization, or how you excrete those nutrients. So it just changes your chemistry a little bit, I guess would be the best way to describe it. And that can lead to different side effects, that can lead to adverse reactions, and it can actually lead to some other conditions if you deplete the nutrients too much and don't realize that it's happening.
So how common is this? Is this something that, that you see on a regular basis, or is this something that you can discuss with your customers, clients, after they pick up their prescription and say, all right, this is going to possibly impact that, so you might want to do this?
It's common. Most of the drugs, even on the top 10 list of what is dispensed in the country, all cause nutrient depletion. It is something I personally try to mention to my patients. Oftentimes, especially if they come back and when you're following up with them after they get a prescription for the first time and they're like, hey, I'm having more fatigue, or I'm having this happen. It's really, I think, a good time to look at their medication profiles and talk to them about what are you taking and what could be missing, or what could that single medication or combination of medications be preventing you from absorbing or utilizing correctly, or actually needing more of in some situations of certain vitamins and minerals to prevent some of those effects that they might be having. So I find it very common. It's not, for some people, it's, I guess it's not like bright light screaming going, I'm short on this. It's subtle. Most of these are subtle changes that some people, if they're not in tune with their body, may or may not realize, and others notice over time. So it's more, a lot of them aren't these dramatic, like all of a sudden you're falling asleep all the time. It might just be subtle, more fatigue, or a little bit more cramping, or your nails are breaking more, or different things like that. So it's more subtle signs than glaring depletions. I would say they're more suboptimal levels versus often true complete depletions.
Now, could this, I guess, do you see this more in customers or clients that come in that are taking a lot of different medications, or really is it something that you could, if you just take one drug, this could also happen if you're taking one form of medication as well?
Yeah. So it can happen with one medication. One of the biggest ones that it's probably one of the most prescribed medications, or it's also available over the counter, is like proton pump inhibitors, which are medications used for acid reflux most commonly, or GERD. It's drug names like Nexium, Protonix, and you'll see omeprazole or esomeprazole as some of the generic names. You can buy them over the counter, and they are one of the most notorious ones for causing multiple nutrient depletions, and you can get those over the counter. So someone taking just a proton pump inhibitor could have it, or birth control. And then I do see it a lot more. I do see it more pronounced in patients as they take more medications. Sometimes taking one medication can create a deficiency and cause you to end up taking another one. So one of the examples I usually give for that is metformin. So people with diabetes on metformin, it's known to deplete vitamin B12. But B12 deficiency or low levels can actually cause tingling in your fingers is one of the symptoms. Well, tingling sensation can be mistaken for neuropathy, which can also happen in diabetes. So is it really the diabetes progressing, or is it just a shortage of B12 in your body causing those symptoms? So as you get more medications, the risk goes up. Obviously, I tend to see more medications in older patients, and those patients, as you age, you have poor absorption of vitamins and nutrients. So those two combinations of more medications and poor absorption, and oftentimes I usually see poor diets, usually all combined for like a trifecta of having some type of nutrient depletion / suboptimal levels.
So you pretty much answered, I think, my next question, because my next question was going to be, what are some of the most common types of medications that can deplete our body, which you mentioned, obviously diabetes drugs like metformin, proton pump inhibitors, things for acid reflux, anything else that stands out. I see things like, things like statins, but, was it statins and CoQ10?
Yep. Yeah.
So that's pretty common. I think I've seen.
Very, very common. So statins, I think all the top conditions that you see. So as we said, acid reflux medicines, they deplete tons of vitamins and nutrients. Their depletion mechanism is basically the mechanism by which they work. So they decrease stomach acid. By lowering your stomach acid levels, you don't absorb some of the nutrients as well. So that's usually like vitamin Bs, the whole family of vitamin Bs, iron, magnesium, zinc. And so you see that in proton pump inhibitor patients. With statins, you're 100% correct. They are one of the most commonly prescribed medications, and they are notorious for depleting CoQ10. You can also have genetics that prevent you or increase your risk by being a poor converter of coenzyme Q10, but coenzyme Q10, for those who don't know, are basically the source to produce energy. So ATP, they work in your mitochondria, back to biology 101, mitochondria, ATP, that's because of CoQ10. So that's why oftentimes in statins, you'll see muscle pains is due to the lack of CoQ10 that your body is depleting. Statins also are notorious for, because of the way they work, they decrease cholesterol. You'll also see a decrease in hormones. So I see low testosterone as one of the main, not a true nutrient, but it's a hormone that affects your body in massive ways. So you'll see low testosterone levels often. I see birth control pills change the microflora in your GI tract and affect absorption of a lot of nutrients, B vitamins, iron, magnesium. Antidepressants, not as much as a depletion as they really require you to be very optimal on your B vitamins. B vitamins are cofactors in forming neurotransmitters such as serotonin and dopamine. And so if you're short on that, your antidepressant may not work as well. So usually optimizing B vitamins if you're on an antidepressant. Diabetics, we have unfortunately a lot in this country on metformin. Metformin has a lot of benefits and helping reduce A1C levels, but it does come with its negatives of some nutrients, and it's really good at decreasing, again, B vitamins, magnesium, CoQ10, folic acid. So that is one of the things you have to look out for. Most people can do well on just like adding a good solid multivitamin, a good quality multivitamin to help with a lot of these. You don't always have to take a specialty supplement for just that one, but oftentimes they deplete multiple vitamins or across the spectrum. So I usually recommend a good quality multivitamin and then supplementing based on symptoms and kind of what the patient's experiencing.
Yeah, no, because I take a statin, my ApoB levels are a little high, which, for people going, what's ApoB? I think it's a better indication for looking at clogged arteries with LDL. So I was like, let me increase my statin a little bit. But I also take CoQ10 in ubiquinol form just because I know it's a little bit better absorbed and more
Yes.
bioavailable. So I was like, I know those side effects with no significant family history of heart disease, but I'm like, I have to take that preventative approach. So it's good to hear all the different things, at least the different types of drugs that we have to be concerned about, which kind of leads to my next question is, could some of these medications, I guess, they cause nutrient depletion, but could they cause a nutrient deficiency if they're consumed for too long?
Yeah, definitely. I mean, I've definitely seen nutrient deficiencies. B12 is probably the most common one that I see of nutrient true deficiencies. Vitamin D, sometimes it's medication, sometimes it's lifestyle / medication combined together of true deficiencies and levels of just you're like, oh wow, that explains why you're so tired, and some of your symptoms is those numbers are completely low. Magnesium is very difficult to measure a true deficiency because of how it's stored in your body. But oftentimes the studies are showing the amount of people deficient in vitamin D in magnesium is just huge in this country. Some of it due to the poor quality of our foods, the diet that most people follow, drinking carbonated beverages that decrease absorption of magnesium, proton pump inhibitors, throw everything in there. So you do see a lot of deficiencies in that also.
That's interesting about the carbonation in beverages decreasing magnesium, because people don't realize magnesium has a lot of functions. There's a pretty nice size deficiency from what I saw, in the global side of things. A lot of people are magnesium deficient and are not supplementing, at least with the right forms. But that's interesting to know that carbonated beverages can deplete the magnesium. Interesting.
They do. And one of the other things, and I was kind of diagramming this out one day, and chronic stress leads to magnesium deficiency. Your body uses magnesium in the production of cortisol, and obviously chronic stress, you're producing a lot of cortisol. So add America's lifestyle or everyone's lifestyle, there tends to be more stress these days. So you start seeing magnesium playing a role in many things as stress induced, also causing some lower levels. So add a lot of things together, and magnesium is probably one of the number one recommended supplements I add to most people to help with a variety of symptoms.
Excellent. Now, how do you balance, so when you have a nutrient depletion from medication, how do you balance this as when it comes to needing, the person still needs to take the medication, obviously for a medical condition, but if they're nutrient deficient, does this mean hey, we need to start supplementation, we need to change their diet? What do you think is the best approach there?
So most of the time I start with supplementation just to get them feeling better or kind of help resolve the symptoms and see if that improves. 9 times out of 10, you can't stop the medication. Proton pump inhibitor, if you've been on it, it's one of those medications I highly recommend not stopping suddenly and working with your doctor on slowly getting off of them. So it's a multi-prong approach. I think supplementation is number one. And then looking at, is it lifestyle? What is the medication being used for? Is there a different way to approach that condition that may be able to get you off that medication? So if it's a diabetic, is it helping them start an exercise plan and looking at their diet, which may lead over the coming months, year, weight loss to control their diabetes? I feel like it's a multi-prong approach, but usually it's not stopping the medication suddenly. It's adding a supplement to help with the symptoms and then looking at what further steps could be taken to help them with that condition that they're dealing with, and if there's any way to get them back off the medicine.
Now, this next question may be a little bit more difficult to answer because I'm sure it depends on so many different factors, but how soon could a particular medicine cause nutrients to be depleted? Could this happen in a week, or does it take time?
It usually takes a little more time. I mean, there's some medications out there that are not a lot that you would see most of the population on. So like statins are probably the one you see it happen the quickest. I see most people notice the muscle pains and aches in the first week to 2 weeks. You're less likely to see like a metformin or a proton pump inhibitor, those effects to pop up instantaneously or within the first few weeks. It'll be a much slower, more subtle process. Statins are probably the one that you see the most glaring sign. The other ones you see that are chemotherapy agents are specifically used sometimes to cause a nutrient depletion. There's a couple chemos that completely deplete folic acid. So you can't supplement with folic acid because that's the way the mechanism of the drug works. But they do a lot of counseling and explaining that to you ahead of time. But that's the goal of the medicine. So obviously you wouldn't supplement for that. But in general, the medications that most people are on for daily maintenance of chronic conditions, besides statins, everything is a much slower, more subtle process.
Yeah, and it's just interesting to kind of see all the different types of medications that impact this. But I guess the hard part's going to be, as I lead to this next question about side effects, is kind of figuring out, because when I listen to a drug commercial on TV, it's like the guy, it sounds like I'm listening to the guy at an auction talk about all the different side effects. It's like, and all the side effects are blah, blah, blah. I'm like, I would have never even been able to comprehend what that person just said, because there's every medication has a laundry list of side effects.
Yeah.
But
Yeah.
and when you look at that, it's like, okay, well, number one, you're looking for the side effects of the medication. Now it's like, if I have a nutrient depletion, how do I know if it's the medication? How do I know if it's a nutrient deficiency? I guess that's probably the hard thing, because if there is a problem, they're going to go to their doctor, I'm assuming, as opposed to coming into the pharmacist, because how do we know? Like, how would someone look for or indicate that they have a nutrient depletion that's based on the medication?
It's
And
tough.
I'm sure
So
there's
it's
so many, like
there's
B12 is going to have this and that's going to have that, etc.
Yeah. I mean, there's some of the side effects you look at, like, I mean, I always laugh at those commercials too, because I'm like, it sounds like a car salesman. Like, they're like, blah, 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 as fast as they can. I'm like, oh my gosh. And like, obviously as a pharmacist, like, you're expected to know a lot of that. And sometimes I look at it and go, oh my goodness, that's a new drug. I haven't seen that one yet. And but a lot of the effects that you see from medications, some based on mechanism of action, so drug classes, there's a lot that are very similar across that can be explained by mechanism of action, and some are known to be due to nutrients. I feel like, sadly, with healthcare today, a lot of times the offices and providers don't have the time to spend with a patient to take the time to really listen and hear if it's truly something that may be caused because of a nutrient depletion versus a side effect versus a new condition popping up. And oftentimes it's just jumped to give another medication to help with that problem. So I think really sitting down, I always encourage our patients to come back and talk to us about what's going on, what are their side effects, what's happening with when they get a new medication or when they're having a condition. Come talk to us and let us look and see if it might be caused because of a nutrient. And then simply supplementing that nutrient and trying it and seeing if it resolves. I mean, I feel like that's the best test for most people is if you add the nutrient we think might be causing it and your symptoms improve, then it's highly likely it might be that. They can do lab work. Sometimes labs will show levels within range, but not optimal. A lot of people, the levels are constantly changing, and it's based off like a population normalization. And so as the country starts to get slightly unhealthier, those labs that are used to be in a normal range suddenly slide down a little bit. So what's normal now wasn't normal before years ago. So making sure your numbers when you get lab work are in optimal ranges, which might be slightly towards the higher end of normal versus the lower end of normal. So looking at labs. And again, I think a lot of it's like trial and error and listening to your body and trying, if I added magnesium, does my anxiety feel better? Does my muscles not cramp if I add CoQ10? Just trying it is probably the best test.
Excellent. Yeah, and that's like you mentioned, you got to get tested, right? It's like we can test our body for a lot of these things, B12, B vitamins, micronutrients, as you mentioned, with calcium and magnesium. All these things can be tested. It's not very common to go to the doctor and say, can you test my magnesium? And they probably look at you like, why? Right? I've asked my doctor numerous times about, I want to get certain things tested. And he's like, why do you want to do that? He's like, can you educate me on that process? And then he's like, oh, that makes sense. And I'm like, okay, it's kind of scary that I have to educate you on this and why, but it's just not, it's outside of the traditional realm of conventional medicine.
It's definitely not taught in school. I mean, I have a lot of friends that are PAs and physicians and pharmacists, and like, they'll call me and ask, they're like, where do you find this? Like, how have you learned this? And we wasn't taught in school. Some of the stuff I talk about is like female hormones a lot in athletes, and people are like, how do you know this? And like, it's a lot of like, I feel like a sense of curiosity and really trying to piece together different parts of what you were taught, and sometimes throwing the conventional medicine of just add more medications to treat conditions, and being like, looking at truly like a root cause of what might be the cause of what you're going through or what's happening, and trying to get to that level. So I always tell people it's kind of functional, it's kind of integrative medicine, where it's looking at the whole patient and really trying to help with like skills and different things, versus always adding more medicine, which I feel like is conventional medicine. They just add more and add more.
Yeah. And that's not uncommon. Yeah. Now, I want to change, kind of want to reverse topic. We talked about the impact of drugs depleting nutrients. I want to kind of talk about really drug nutrient interactions, since drugs can interfere with how our body absorbs or metabolizes nutrients.
Yeah.
Can this have the opposite effect, where certain nutrients impact the effectiveness of the drug?
Yeah.
And what are some of those common, I guess, things that, like, I've read something about, like, if you're taking a blood thinner, try to limit or avoid vitamin K, or what are some of those examples?
Yeah. So probably that you're speaking of is, so the blood thinner is warfarin or Coumadin. The mechanism of the drug is to deplete vitamin K, and vitamin K is utilized in your clotting factors. So if you deplete it, you're less likely to clot. And so by having a diet, if you start adding tons of vitamin K, you are going to just negate the effects of the Coumadin. So they really, if you're on Coumadin, they really want you to have like a consistent level of vitamin K in your body. So don't suddenly go on like a diet of dark green leafy vegetables or eating chicken livers, because those are two rich sources of vitamin K. One of the other ones I see most is patients on thyroid medication. And so if you have low thyroid, often people have to take supplement thyroid, which is levothyroxine. If you take a calcium or magnesium, so could be a supplement, could be milk, could be yogurt, could be as simple as taking a Tums in the morning. Anything with calcium or magnesium actually binds to the levothyroxine, and you don't absorb the levothyroxine. So you could be taking doses of a medication, and you're not getting the effects of it because you're taking it with something else that binds to the drug. You also see that sometimes in there's a class of antibiotics, so like tetracycline or doxycycline. That same thing happens if you take it with like a calcium or magnesium. So that's ironic, because a lot of times you tell people with antibiotics, take yogurt. Yogurt's rich in calcium, but if you take yogurt with doxycycline, it can bind to the doxy and not absorb, so you don't get the effects of the doxycycline. So it's like, you can take it, but take it 2 to 4 hours away from the other medication.
Yeah. And that's what's interesting, because you look at some of these medications, and you mentioned, it's like, well, I might need to stop eating certain foods because it's going to impact the effect of or it's going to prevent my drug from working. And that's kind of scary that we have to adjust our diet. That could be life-threatening if we, consume, like you said, you need the blood to thin, but if we consume way too many green leafies, or we're consuming a multivitamin with a lot of vitamin K or vitamin D and K, then it's going to cause an opposite effect. That's interesting.
Yeah. I usually tell patients, whatever you do if you're especially on Coumadin, it's such a finicky drug in general. genetic wise, metabolism, diet. I usually tell people, whatever you do, just be consistent, especially on Coumadin. It makes keeping your dose much, much easier, and your risk of bleeding or clotting, both ends of the spectrum, less if you just kind of stay with a consistent diet. So if you have green leafy vegetables, that's phenomenal, because obviously it's a huge staple. You get so many vitamins and nutrients from it. Just be consistent, like eat it once a day or eat it 3 times a week. Just don't go on like a splurge.
Yeah. And that's the hard thing with diet to balance. My wife was on a blood thinner because she had a blood clot in her leg last year, or about a year and a half ago. And I was like, hey, you got to stop eating greens. And she wasn't aware, because the doctor didn't tell her anything about those contraindications. I was like, you gotta really chill out with the spinach intake, because it has the opposite effect. And she didn't realize that was a side effect.
Yeah. I think it goes back to the time that you have as a provider with a patient, and they tell you, sometimes I feel like it's word vomit to the patients. They're already overwhelmed with what conditions they have and what's going through their mind. And they get thrown at like 15 different things, and some of it doesn't, you can't intake it. I mean, I've been a patient and had stuff thrown at me, and I'm like, wait, what? And like, I'm in healthcare and this is what I do. And so I feel like there's so much given to you at once, and they sometimes assume that you're going to talk to a pharmacist, or assume you're just going to look on the internet, which is overwhelming in of itself. So sadly, I feel like the time that you have with a patient in healthcare has decreased the quality of education, counseling, listening to a patient.
Interesting. Yeah. Now it's a scary, there's like you said, there's so many interactions and so many things going on in the body, so many things being consumed. It's hard to pinpoint where those things are coming from.
Yeah.
Now let's talk about age. Oh, sorry. Go ahead.
No, I was going to say, it takes time and in-depth curiosity and research, I think, to really get to the bottom of some of those.
Yeah. Let's dive into the age factor a little bit. How does age impact how our body metabolizes certain drugs and depletes nutrients? Do you see more older adults experience this versus younger adults or children?
I see it more in the older population, not so much that it changes how you metabolize, but your body slows down in general. So you don't create as much stomach acid, so you don't absorb as well. Your GI motility decreases, so your stuff stays in your belly longer. You may increase more side effects because the transit time of a drug is longer. How your body actually metabolizes through your liver, a lot of that is genetic. So you may be a slow or a fast metabolizer. That has to do with genetics more so than age. With kids, I see a lot of the medications I have in younger adults tend to cause nutrient depletion. So I see like Adderalls, like a lot of the stimulants, because they decrease appetite. You have kids that are now under eating, and as we both know, and a lot of people know, under eating can cause a whole plethora of nutrient depletions, including like proteins and muscle growth, in the big scheme of things. Antidepressants, anti-anxiety medications, and birth control pills, all of them have nutrient depletions. And that's what I see most commonly in kiddos and young adults. As you get older, you start adding multiple medications and seeing physical changes in the body. So you have less muscle mass as you get older. And that affects how drugs are distributed throughout your body. So you increase risk of side effects. Your kidneys may not function as well. So you may not clear a medication as quickly as you did when you were younger. So you may have more side effects because of that. Drugs tend to, as you get older, hang around longer. So I feel like that's what causes the side effects, not so much the nutrient depletion has to do with, again, the medication affecting the absorption time and I think a slightly poorer diet.
Now, you mentioned muscle loss as we get older, that sarcopenia or age-related muscle loss. We actually had a podcast specifically just on that, which I found really interesting. But, I read where 50% of adults, I think over 70 or over 75, take cholesterol meds. And as you mentioned, muscle weakness, muscle pain, CoQ10 depletion, those are major factors that can seemed to affect mobility. My mom, she's like, hey, she had to stop taking her statin because her muscles, she rides horses, and obviously she's still very active at 71, but she's like, my muscles just hurt all the time. So she stopped taking her statin, but she's been taking it for a long time. So I think that's probably the length of time is probably a factor in that as well.
Yeah. I mean, I've had people start a statin in a week or two, have muscle pains, but I mean, as you get older, the muscle pains, I feel patients are like, well, I don't feel like moving as much. And I'm like, no, we need you to move. Like the benefits of exercise and movement, I feel are so underappreciated and so undervalued that some people will say, we'll stay on a statin, even though the patient's like, I don't feel like moving and I hurt. So I don't want to work out. So therefore they're losing muscle mass and they're losing movement and they're losing flexibility and increasing the risk of falls. And you're like, looking at it going, but it's so hard to see somebody have that impact on their quality of life when there could be some other options out there. You might have to get creative with it, but I feel like watching as a patient gets older, lose their movement and their muscle and their zest for life and their hobbies because they ache and everything because of side effects is just gut wrenching.
Well, I think some people are intimidated about exercise because they think they have to do a long bout of it or a lot of it to see benefit. And I just read a new study. I know we're off topic, but I wanted to share this because a new study just came out and showed short bursts, 2 minutes of short bursts or up to 15 minutes a week, which is not much, can reduce your risk of all cause of death by like 40%. You would see a 50% drop in cardiovascular disease by if you just went outside or just did 2 minutes of anything high intense for that individual. And I was like, okay, I think anyone can commit to 2 minutes.
2 minutes?
2 to 3 minutes a day. Anything high intense for that individual, getting their heart rate up, doing a short burst of high intensity. And I was like, oh, wow. I'm starting to play pickleball in my 40s and getting away from a lot of I used to love playing pickup basketball and just sprinting back and forth. And my heels just can't handle a lot of that anymore.
Yeah.
So it's like, oh, I can do, short bursts, even though lifting is considered that. But people just have to do something small. And like you mentioned, the benefits of exercise are massive when it comes to that.
Yeah. I feel like so many people feel you have that like all or nothing. It's either like, I have to do 30 minutes, 5 days a week. And I'm like, shoot for 1 day a week right now. Get up and just walk or, go outside and kick the ball with your grandkids or your kids or, while your kids are at soccer practice, do some lunges or push-ups. There's so much stuff that you can do. I had one of my neighbors, she was walking in the mornings and she's like, I need to figure out how to step up my game on my walking. And I was like, hey, I have a backpack. We'll put like some cans in it and you can just walk with a weighted backpack. And she's like, oh my gosh, I love that idea. And just the little extra resistance. And so, I mean, it's so, I feel like the culture is created is somewhat of a all or nothing. And you have to do it X amount of time for this long, when that study and so many others have shown that it's just small changes and small bouts of movement and getting your heart rate up and challenging it produce huge benefits.
Yeah. Last couple of questions, Dr. Beal, that I want to get into. And I think this is a question I wanted to ask only just for personal, but my daughter takes ADHD medicine. We haven't really talked about that much, but are there certain drugs and medications that children take regularly, such as maybe an ADHD medicine, that could cause vitamin mineral depletion?
Yeah. So ADHD medicine, I see a lot in kids. The biggest issue with ADHD medicines is the suppression of appetite. I mean, most kids you'll see from what I get from parents is they don't eat lunch. They don't really want food until they get home. And so making sure that the kids have a solid quality breakfast before they take their medication so that they are nourished throughout the day. And then making sure you have a good dinner for them if they're not eating a solid lunch because they're not hungry. So you'll see under eating commonly in younger kids or especially teens as they're growing, they're still not hungry. Athletes, I see this often. It's a struggle. We're trying to find creative ways to get them food. So they're taking ADHD medicine and they're practicing at 2 or 3 in the afternoon after school, and they're still not hungry. So trying to make sure they have simple carbs, and they're trying to make sure they eat and drink enough to get through a practice so they have energy and they're not bottoming out at the end of practice or just completely starving when they get home. So I'd say ADHD medicine, the number one thing I see is just under eating, especially on like proteins. And so you see muscle growth being inhibited. Sometimes it's hard to know if it's the medication or if it's the condition. There is some information showing like magnesium and omega-3s being short in patients that are ADHD, and whether that is the condition beforehand or some of the medication. I haven't like teased through it enough, but those are 2 supplements I usually always recommend with my stimulant kids, is taking both of those for their benefits.
Excellent.
The antidepressants are probably the other thing I see a lot in kiddos. Again, those B vitamins definitely needing to be at high levels. Some kids I will have on like antipsychotics, so which are usually used as mood stabilizers. So kind of like a bipolar or just a major depression, they may help use an antipsychotic. And antipsychotics are interesting in the fact that they actually cause an appetite stimulation. And that stimulation is usually for like sugary foods. So you'll see one of the main side effects they have is weight gain with antipsychotics or mood stabilizer. And usually that weight gain comes with insulin resistance, because oftentimes the weight is due to craving sugary, simple carb foods. So so those are some of the ones I see most in my kiddos, and birth control pills, which we've touched on a few times.
Excellent. Last question. Anything else you would like our readers to learn about this topic? And one question that I have here is, are there any important questions someone should ask their pharmacist before taking a medication, especially when it comes to what we're talking about today with nutrient depletion?
Yeah. So one thing I would highly encourage everybody listening is ask your pharmacist questions. Like we're busy, but I will tell you, every pharmacist I know wants to talk to patients. Like we got into the field of pharmacy to help people. So being able to have that time with a patient, ask, what am I supposed to expect from this medication? What am I expecting it to do? What am I expecting as possible side effects? What do I need to do? Any changes in my diet? Is there risk of this causing a nutrient depletion? What am I supposed to do if I have a side effect? Do I stop it? Do I call my doctor? Like, what do I do? So really, engaging your pharmacist, whether that be in person, calling them on the phone. We love to talk to patients and don't get that opportunity, because a lot of people, I think the study shows like less than 15% of people actually ask to talk to their pharmacist when they get a new medication. And I know all of us, like, I crave that conversation. So I really would love patients to really feel comfortable in asking your pharmacist questions before you start a medication, so you know what to expect. And the other thing I wish patients would know is, like, listen to your body and notice small changes. Those small changes may be nutrients that are decreasing or suboptimal. And I think being persistent and not always taking, here's another medication, and asking, could this be caused because of a nutrient? And being really curious of your body and listening, and not always just going, I need a medication for this. Like, what is the root cause of why could this new symptom be popping up? I think those are probably 2 things I really hope patients get out of it.
Excellent. Great information today, Doc. Thank you so much for spending time with us to share your expertise, because this is a topic we've never really discussed on this podcast. It's just really medication in general. So this was very unique, but you're not finished yet, because we have what's called our curveball round. This is where I'm going to ask you 3 different questions. I come up with these questions while we're sitting here talking. one is always a staple. So that's going to be the first question I ask. But two, I think my second question is going to be a little unique. And then three will be something that I've asked only a few people. So question number one, first of all, are you ready for the curveball round?
I'm ready. Let's go.
All right. So question number one is my staple question I ask everyone. I'm a music junkie. If I can go back in life and start over, I would try to be a full-time musician, which I'm not very good at. Or I would be a sound engineer or someone that just works in the recording side. So as someone who has attended a lot of concerts over the years, if you could be the lead singer of any music group or any band, whether that's in the past, today, or in the whatever, who would that be?
That's the funniest question ever, because I am complete opposite with music. My husband is the music junkie in our family, and he will tell you I don't know any bands. And like my answer to everything is like Led Zeppelin, who sings this? And he gets like offended that I don't know like who the lead singer of like U2 is sometimes, or yeah.
All right. So who would be his favorite band? And I guess we got to get him on the podcast.
He's like an Allman Brothers kind of guy.
Okay,
Like
so he's a jam band kind of person.
Yeah, he's a jam band kind of guy. I go between like my dad made me listen to country growing up, and my mom made me listen to 50s and 60s like Buddy Holly, Elvis, and like I'm a sucker, but I'm also a sucker for like 80s hair bands. So I don't have a good answer for that.
That's okay. That's fine. I actually attended my first country concert about a week ago because I'm not a country fan by any means. I respect it. It's just slow and it makes me feel depressed. But my wife is a big country fan. So I was like, I'll go. We were out of town for a work conference and we saw Miranda Lambert. And I was very impressed with just the production. Vocals were great. And I'm like, okay, I still owe her like 9 more concerts because she's attended at least 8 or 9 of my hard rock and heavy metal band concerts that I enjoy. All right. Question number 2. If you could, as a pharmacist, if you could create one drug that could fix one health problem in the world, what would that be?
Exercise. Like, I feel like if you could bottle up exercise or movement, that would fix so much.
Yeah. Exercise is medicine. I mean, that is a term the Medical Fitness Association has come up with. And I agree. That's a fantastic. If we could create something that would motivate people just to stay active on a regular basis, it could really fix a lot of mood, obviously mood and anxiety conditions, obviously body weight, or at least muscle body composition. I love that. That's impressive. All right, last question. If you can go back in time and talk to young Jessica, what would you tell her?
I would tell her, I think after everything I've been through, I would say what I would tell my younger self is that you're always enough. Like, when you don't think you're enough, you're enough. We obviously didn't really touch on this, but I went through an eating disorder, really severe eating disorder in college when I was playing sports, dealt with a lot of insecurities, and always felt like I never was enough and always tried to push more and harder and harder. So I think going back and saying, you're always enough for where you are right now, and you're always loved.
Awesome. That's fantastic. Dr. Beal, thank you so much for being on the podcast today. Fantastic information. We hope to have you back in the very near future.
I would love to. I appreciate it. And I'm honored to be a pharmacist on the podcast talking about medications. And thank you for broaching me on this subject and letting me speak on it. I really do appreciate that.
Well, that's it for today's show. Thanks for listening to the All Me podcast from the Taylor Hooten Foundation, a nonprofit organization leading a national campaign to enlighten people to the truths about appearance and performance-enhancing substances and inspiring people to live and compete without the use of these substances. Please be sure to subscribe to our podcast and tune in to our next episode.